Vanakkam, I am Dr. G. Chandrasekhar. I am a senior cardiothoracic surgeon working at Sri Gokulam Specialty Hospital, Salem, Tamil Nadu. Today, let us discuss about heart valve surgery. What is a heart valve? Heart valve is present between two chambers of the heart. For example, the left atrium and the left ventricle. Left ventricle is the pump of the heart. So this is a valve which is called as mitral valve. And on the right side, between the right atrium and the right ventricle which pumps the blood into the lungs, this is called tricuspid valve. And there are two more valves which are at the exit of blood from the heart into the lungs and to the body. From left ventricle into the aorta, which takes the blood to all other organs in the body, it is known as the aortic valve. From the right ventricle to the lungs, it is guarded by pulmonary valve. So we have these four very important valves inside the heart. They get affected, undergo changes in various conditions. One of them is congenital. Congenital bicuspid valve is one of the most common congenital conditions which affects the aortic valve. Sometimes it is so severe that even in infancy, the baby needs some kind of a surgical procedure to survive. If the baby survives the initial years of life, then they have a fairly long asymptomatic period without any symptoms, till late in life when they start developing symptoms of chest pain, of giddiness, because there is not enough blood that is coming out of the left ventricle into the aortic systemic circulation. Then we have what is called as rheumatic heart disease. This is because of beta hemolytic streptococcus infection in childhood, what is called as acute rheumatic fever. Usually these children are from lower socioeconomic status and they live in a very congested environment, so that they get this infection very often, and sore throat, fever. This is the commonest presentation. What happens is, like, also they have joint pains, fleeting joint pains which move from one joint to the other. Today they are in the knee, tomorrow they go to the ankle, like that. They keep moving, fleeting joint pains. There is a saying that goes like this: rheumatic fever kisses the joints and bites the heart. So it affects all the layers of the heart: the pericardium, the epicardium, and the endocardium. Endocardium is inside of the heart, the lining that is inside the heart. And it damages the valves. The commonest valve that is damaged is the mitral valve. And next is the aortic valve and the tricuspid valve, and lastly and rarely the pulmonary valve. There are other conditions like degenerative valve disease, where because of the age the valves get affected. There may be a leak in the valve, or there may be an obstruction in the valve which is called as stenosis. So what are the options available today for a surgeon One of them is valve repair. If children are young, we prefer repairing the valve, keeping their natural valve in its place so that they need not have any extra medications like blood thinners, which is essential when we replace the valve with an artificial valve, which is called a mechanical prosthesis, which is made out of pyrolytic carbon. Because it is a foreign body and there are chances of blood clotting, the valve itself can clot with the surrounding, clots can get blocked. So we need to keep the blood thin. This is a lifelong endeavor. And because we are keeping the blood thin, if it gets much thinner, there are chances of bleeding. Bleeding can happen anywhere in the body, in the brain. Bleeding can happen in any other organ system. Or when the valve replaced person, he falls down or something, then he can have hematoma, bruises and bleeding. So these are all kind of dangerous complications. So we would rather repair the valve as far as possible than replacement. There is another kind of valve that is available, which are called as bioprosthetic valves. Bioprosthetic valves are made from animal tissue. It could be porcine, that is pig, or bovine, or sometimes even horse pericardium. But the life of these valves, bioprosthetic valves, is limited. They can function for about 10 years, 12 years, maximum 15 years. Later on, they fail. They fail because of degeneration, because they are also foreign tissue inside the body. So the body reacts to them and they degenerate and then they fail. So this is about heart valve surgery. This is the topic of today. I hope you have understood. And heart valve surgery is expensive because the heart valves which we use most of them are imported. Even though we have our own TTK Chitra valve, which is produced in India, researched in India and produced in India, but many people prefer bileaflet valves which are imported, either most of them from USA, which are expensive. So heart valve surgery is a bit expensive compared to other surgical procedures in cardiac surgery. Thank you.